Hello, this is Rashi Sahai, and you're watching MediCircle. Today, on our cancer awareness series, we have Dr. Karthik with us. Dr. Karthik is a consultant surgical oncologist at KMC Hospital, Mangalore. For the past 9 years, he has been working in this field. Welcome to MediCircle, Dr. Karthik.
Hello. Thank you. Thank you for that introduction, and thank you, ma'am.
So, oral cancer is the most common cancer in India. Amongst men, 11.28% of all cancers, and the fifth most frequently occurring cancer among women, which is approximately 4.3% of all the cancers. So, doctor, can you please tell us what is oral cancer?
Oral cancer is cancer of the oral cavity. So, oral cavity, whatever starts from the lip or the outer part of the lip, going into the oral. I need not put an anatomical definition here because it will be difficult for people to understand. So, whatever is bound by that is the oral cavity. Okay, so the cancer. So how do this present? So actually, these people usually present with ulcers or a proliferative disease in the mouth. So usually these are 90 more common, up to 90% correlation with the tobacco consumption. Tobacco in any form, it may be the chewable form or the smoking form. So oral malignancy is highest among the people who consume tobacco in any form.
Okay, doctor. So, what are the signs and symptoms of oral cancer?
The first thing is we should focus on these high risk individuals who are using tobacco regularly in any form, like I already told. So in such people, if they present with any kind of ulcerations in the mouth, and those ulcerations which don't heal more than 1 week or 15 days, they have to take guidance from their doctor, nearest doctor, if not from an oncologist, at least from any of the doctor. Having told so much correlation between the oral malignancy and tobacco, there's other correlation like human papilloma virus and sharp tooth. Nowadays, I've got few patients, like I have recently treated a software engineer who's only 28 or 29-year-old lady who had a sharp tooth which was unground or untreated for last few years, and suddenly she presented with an oral lesion in her tongue. So those people, so it's not that it's always correlated with the tobacco, and we should also any oral lesion which is not healing, you have to come to us doctors and get it evaluated scientifically.
So, what are the preventive measures to treat oral cancer?
So when we know the cause, that is the route where we have to start. So of course, like oral cancer prevention is best done by avoiding tobacco. See, basically, like any tobacco, a person taking tobacco in any form, if he's been consuming it, once he stops using it, that person will never go to normal. He can only reach near normal. That too takes around 15 to 20 years. The prevention is the best strategy here. We have to guide and train people, or we have to educate people to avoid smoking in all forms. That is the best way to prevent. And in those people who are already smoking and in the high risk group, we have to tell them to visit a doctor whenever they have any ulcerations in the mouth. That is the best way to go forward.
So, how doctors diagnose this type of cancer?
So yeah, so we usually get these patients who had presentations. Like we find few people who went to a oromaxillary surgeon or a dentist to get their loose tooth extracted, and there would be a ulcer there, and other people ulcer in any part of mouth. So these are the kind of presentations. So then we stratify them on the risk. For example, our index of suspicion increases when the patient is using tobacco already. So in such people, we evaluate aggressively. In other patients who are not group on a high risk, then we give some time. If the ulcer is not subsiding in another 2 weeks or 3 weeks, we ask for a biopsy and then treat according to the biopsy results.
So, how serious is oral cancer?
Yeah, see, a problem with oral cancer is like it decreases our efficiency. Like the patient won't be able to eat. There will be a lot of pain, and it's a locally aggressive tumor. These tumors rarely spread to the other organ, but they cause so much of morbidity by infiltrating the surrounding tissue. So nowadays, the government has increased its strategy against tobacco. So people watching movie, they would have seen this famous anti-smoking ads where they show the part of the tumor being removed and how the flap and how the morphology changes and things. So at an individual level, it changes. It is associated with a lot of morbidity, especially when the patients present late. But when the patient present to us early, we can do a very good surgery or a very good treatment with minimum morbidity and a very good treatment outcome. So that is about for an individual. As a society, if you see, it is like you already mentioned, in India, it is a huge chunk of population is affected by this oral malignancy. So the best way is to like what government is already advocated or doing is like strategy is towards anti tobacco.
Yes, doctor. So on MediCircle, our main focus have always been to provide the audience with large amount of information in less time. And so today we will be conducting a small question answer session in which you can answer in 1 or 2 line sentences.
Yeah.
So, doctor, can a cancer patient live a normal life after treatment?
Yeah, very much, very much. So it's not. It's a myth that people think that cancer is not curable and all. I already told if the patient can come to us very early and get it treated early, the morbidity of the treatment and disease will be very minimal, and the patient survival will be very long. So it is a very wrong thought that cancer is not curable. Uh, Only thing is, more in India, what is happening is we are getting more and more patients in stage 3 and stage 4. So when the people present in stage 3 or stage 4, the morbidity is higher and the survival also reduces drastically. So please present to the doctors in the early stage and get evaluated and treated in the early stage.
So, does oral cancer spread very quickly?
See, regarding spread of any tumor, there are two things. One is the tumor biology, the how aggressive is the disease, and another is the host immunity. So, how much body can tolerate or show a defense mechanism towards the tumor. So, it is a balance between the tumor's aggressiveness and the body's immunity. So, it is very difficult to say which tumor behaves how in which kind of body. Best thing is to present to the doctor as early as possible.
Okay, doctor. So, what is the average age of getting oral cancer?
The oral cancer are more common in the age group of 40s, that is in the fourth or the fifth decade. That is more common to have oral cancer. But we get patients from all age group. I told you we get patients as young as 25, as all because they would have started their tobacco or these nowadays there are more the tobacco associated habits and things. And then we have patients who are 80 or 90 years also, but most of the chunk comes at fourth or fifth decade of their age.
Thank you, doctor. Thank you so much for coming to our show and sharing your valuable time and insights with us at MediCircle. It has been a pleasure having you on the show.
Thank you, madam. Thanks for the opportunity, and hope this is useful for the people around you. Thank
Yes.
you.